Alright, so we're about to hammer more on the next topic in what? As related to pediatrics. So we'll be going into what is known as a respiratory distress syndrome. Respiratory distress syndrome. So this one, we are looking at a classification. Classification, that's when we're trying to look at the types, right, of respiratory distress syndrome. So for the classification, it's just classified based on what, whether it is happening in a newborn or if it is happening in what, older children or old people, that's adults. All right. So for newborns, we said that the form isn't typically classified by severity in some structured ways. Okay, but you can have it mild ones seen in children that were born before time, that's before their due date. Moderate, this one requires a surfactant therapy, so your lungs are not being able to maintain the patency for air to like accumulate in it, so you need surfactant therapy. So severity is often severe, that's a severe one. It's often in infants that are less than 28 weeks, may need mechanical ventilation and multiple surfactant doses. So that one is, you give birth to a child and the child is way coming before their due date. Okay, so radiographic grading, there's a way they can actually grade it based on what you see on x-rays. So grade 1, we said I will have the reticulogranular patterns on the x-rays. I didn't actually bring the x-ray showing that, but it's fine, we'll do a different video on it. Grade 2 to 4, there's increased opacity and air bronchograms. Okay, so for the acute distress syndrome, I think this one is basically the one that occurs in older children and adults. The classification is based on what is known as the Berlin definition, which stratifies severity based on what, the oxygen. Okay, that's a measure of what the total oxygenation you're actually having in the body. So that one too, you can have the mild one, you can have the moderate one, you can have the severe one. Okay, so just trying to look at this ratio. This is what you have in this ratio. Okay, so mortality risk, that's a possibility of the patient actually dying from the condition. The first one is 27%, second one is 32%, third one is 45%. Okay, so that's just it for the grading or classification of respiratory distress syndrome. Okay, it's just from mild, moderate, severe. Okay, in either the one happening in newborns or in older children or adults.